Hello, I'm Dr. Richard Downs with Sleep Balance Academy. I want to talk to you a little bit about the Circul ring. I'm going to show you that in just a second here. Let me show you my screen. All right, here's the Circul ring. You can see it's spelled Circul. You can also notice that it has a little arrow on here that points towards the tip of the finger. That's kind of the orientation. Once you do that, this will fit just about many different size fingers because it's expandable through this area here. There's a little spring in there. And there actually comes in two sizes. You can order either size here, small diameter or large diameter. And I suggest you get one of each at least. And you can screen a lot of patients with this to see if they're actually having issues with desaturation or lack of oxygen while they're sleeping. Any type of hypoxia is very detrimental to your health. Let me tell you why this ring is so important. I want to show you how it measures things, but you can order this on dentalsleepbalance.com or sleepbalanceacademy.com. Here is a little bit of a report from me. Okay, this is a report of me. A couple nights ago, I had this Circul ring on to just check my appliance to see how it was working. Now I've decreased my oxygen desaturation index by a lot since I started treatment many years ago, but it's been creeping back up. Some of the tissues in my airway are becoming more less taut and tight and lax. And so I'm going to have to titrate my appliance, maybe open the bite further or bring the lower jaw further forward. But if you just issued oral sleep appliance to your patients, you can quickly titrate them using this device and the Snooor device, which is the positional trainer. And the two together can go a long way to help you titrate oral sleep appliances and do it quickly without having to go with multiple home sleep studies. Now, here is a score that we don't think is in normal range. We want to see that below 5. Here is the pulse ox, your heart rate monitor all night long. And you can see here a small hypnogram, which shows you stages of sleep like stage 1, deep stages, REM sleep, and awake. And you can see the proportion of time that it is in each of those areas. And also this total sleep time and sleep latency score is a lot of information here. This is an FDA approved pulse oximeter, which is invaluable to those people who are doing sleep medicine. So I'd recommend this. Now, one of the things you need to know about this is that many people have a home sleep study, maybe one in their office. A home sleep study is great to have. I'm not knocking that at all. We can also rent those to you if you want to have some in your office. But you want something that's inexpensive. You can loan this out over and over again. And if you had 2 or 3 of these in the office, you could literally screen patients every single night, every single day. You could issue these out. They could come back and you can get those reports and decide if a treatment is needed or if a patient needs home sleep testing. You could easily diagnose or at least recommend home sleep studies to 10 to 12 patients per week. Imagine how that would do. You can't do that with a home sleep study. Once you give somebody an HST, it's out. You don't have any more to give out for the day. And also, they might keep it for a day or two before you get it back. You may be able to do 1 or 2 patients a week, screening them for sleep apnea. What we know is people are interested in this because it's free. We hand it out at no charge. Now you could bill for it a small amount if you want to, because it is a true pulse oximeter test. So this is what I'm recommending for screening for sleep apnea patients, along with the Snooor device, which is a positional trainer. It will help you titrate your appliances, but more importantly, it's a great screening tool for finding patients who need care. And you can do it conveniently and comfortably with this device. So go to the sites, sleepbalanceacademy.com or Dental Sleep Balance, and order a couple of these, at least one of each size, so you can start screening your patients and taking care of those who already are getting treatment. Thank you very much.